Hi, guys. I'm Dr. Chris Storti, and today I want to talk about conscious movement. On a daily basis, I have new patients coming in with pain that seem to have no real cause. And the trigger was always something small, like sleeping or putting on a sock. There's no major injuries, there's no car accidents. This is a person that simply goes to work. Maybe they do some yard work on the weekends. They simply sleep wrong. And then when we examine them, we find that they have this degenerative arthritis in their spine and their knees and their hands. And my question was always, how does this happen? And the answer is simple, it's little by little. So repetitive and poor movements on a daily basis, dozens and dozens of times, cause this issue. And this is called unconscious movement. And an unconscious movement is exactly what it sounds like. It's moving without intention and without awareness. And your body just seems to fall into a pattern that might not be good for you. And thus it causes these microscopic little stresses. And you multiply those stresses by the hundreds of motions a day, and you do that day in and day out, and you get these injuries that I'm seeing constantly. So for example, when you practice in sports, you're taught the footwork, the hand positions, the body mechanics. And as you practice, you keep getting better and better and better and more fluid. And what happens during this practice is you reduce injury, and it actually helps make you stronger because the movements are so efficient. Now, in everyday life, we don't do this. We actually move very unconsciously. We sit, we stand, we bend, we lift, and we do tasks without a thought. We almost just kind of throw our bodies into this position. Now, most of the time, the body can compensate for it, especially when we're younger. As we begin to accumulate injuries and stiffnesses and our bodies are not as fluid, they cannot adapt as well. And so what was originally a small microscopic stress now becomes a very big injury or a very big stress in the body. And if you multiply those movements by the thousands of times, that's how you get the pain that my clients are feeling. So the question is, what do you do? Well, obviously, the first thing I would suggest is getting adjusted. And it seems contrite coming from a chiropractor, but the point is the correction of the misalignment of your body opens up the joint so the joint can move with the ideal range of motion. And then the second thing you need to do is you need to train your body to move yourself properly. And I know it seems very elementary. You say, what am I going to learn how to sit again or learn how to walk? Yeah. We actually take people through a very simple process, very simple movements that literally start training their body how to crawl, where they move one arm and one leg. And it's actually training the nervous system. It's training the body. It's training the nervous system to be more efficient and more fluid. And even though it seems kind of, we want to go to the gym, we want to lift heavy weights, we want to go to the treadmill and walk for 5 or 10 miles. Sometimes just 30 seconds doing these moves can retrain all the neurological connections that connect your brain and your body and begin to start the process of you moving fluidly. So what I tell people to do, I say, listen, go out in the public and look at people walking. Just watch people move. And these imbalances will become very, very clear very quickly. You will see the way a person swings their hips, they move their shoulders, their head is tilted. You'll begin to see this and it'll make more sense. Those movements become very, very obvious when you see people in public. So the second part is something you really can't do on your own because you don't always feel it. And that's the concept of this being unconscious movements. It's something that's happening without your awareness. You really need someone there to kind of point it out to you. So that's why I brought on Amy. She's our personal trainer in the office. And she does what we call a movement assessment to identify all of those unconscious movements. And then she designs a training plan to teach you to begin to move with purpose. And so wherever you are, whatever level, whatever, health level, whatever movement level you're at, she'll start you there and then build upon that. Unlike a lot of therapies where you just start with their program, we actually start with your program. So what she'll help you do is strengthen the muscles that are weak, stretch the muscles that are tight, and she'll be right there to correct you as you do the movements so you can begin to retrain these nerves. If you have to learn how to stand and sit, and that's okay. It can be that simple, but you'll find that these movements that you're doing are actually causing you more pain than you realize. I mean, athletes do it to succeed in their game. We need to do this to succeed in the game of life. If you want to learn more, if you want to get one of these assessments or learn more about it, her movement assessment, it's free to all of our clients and any new patient. Just simply go to the website. Here's the site. It's www.drstorty.com. And there's a section about our staff. Her picture is there. Also at the top of every page, you see a Schedule Now button. Just click that button and book your movement assessment. And that's it. Come in and we'll take care of the rest. All right. Have a great day. We'll talk to you soon.